The human body does not become acidic because of food. Blood pH does not change due to diet. And yet, alkaline-style diets are repeatedly associated with better metabolic health, reduced inflammation, and improved energy levels. This contradiction is where confusion begins. Using evidence from NCBI-indexed medical journals, guidance from the World Health Organization, and established nutrition science, this video examines what the alkaline diet actually does, what it does not do, and why it continues to work for many people despite widespread misunderstanding. So let's start the video. Don't forget to subscribe our channel. The alkaline diet is based on the idea that certain foods create either acidic or alkaline residues after digestion. Diets high in processed foods and sugar are labeled acid-forming, while fruits, vegetables, nuts, and seeds are labeled alkaline-forming. Interestingly, this dietary pattern closely overlaps with global nutrition guidelines. The World Health Organization consistently recommends higher intake of fruits, vegetables, and whole foods to reduce the risk of cardiovascular disease, metabolic disorders, and other non-communicable diseases. This overlap raises an important scientific question. Are the benefits of alkaline diets related to pH, or are they related to nutritional quality? From a biological standpoint, blood pH is tightly regulated between 7.35 and 7.45. This regulation is controlled by the lungs, kidneys, and buffering systems. Reviews published in NCBI confirm that even small deviations outside this range are considered medical emergencies. Clinical research published in journals such as the Journal of Nutrition shows that dietary patterns do not meaningfully alter blood pH in healthy individuals. This is why major medical organizations do not recognize dietary alkalization as a valid medical mechanism. Diet can, however, influence urine pH. Multiple studies indexed in NCBI confirm this. But urine pH reflects what the kidneys excrete, not the internal pH of blood or tissues. Medical reviews from institutions such as Harvard Medical School clearly state that urine pH does not represent whole-body alkalinity or disease prevention. This distinction is critical and often misunderstood. Despite the pH myth, many people report improved energy, digestion, and overall well-being on alkaline-style diets. Scientific literature explains why. Studies published in NCBI show that diets rich in fruits and vegetables significantly increase intake of potassium, magnesium, fiber, and antioxidants. These nutrients are directly associated with reduced inflammation, improved insulin sensitivity, and healthier gut microbiome composition. The World Health Organization identifies insufficient fruit and vegetable intake as a major contributor to global disease burden. This explains why alkaline-style diets improve health outcomes, not through pH changes but through nutrient density. Dr. Sebi is often linked to the alkaline diet because he strongly promoted natural, plant-based foods and discouraged processed and artificial products. He believed that removing such foods allows the body to restore balance and support healing. While modern medical science does not support the idea that disease exists due to changes in body pH, it does support one important outcome of this approach. Large-scale nutritional studies indexed in NCBI consistently show that whole food, plant-rich diets are associated with lower inflammation, improved metabolic health, and reduced risk of chronic disease. The World Health Organization similarly emphasizes reducing ultra-processed food intake and increasing consumption of natural plant-based foods. This is why Dr. Sebi's perspective continues to appear in discussions about alkaline diets, not because of the pH explanation, but because of the dietary pattern involved. In this video, the foundation has been established. Blood pH does not change through diet. The alkaline diet does not work because of alkalinity. It works because it reduces processed foods, increases nutrient intake, and lowers inflammatory burden. In Part 2, the focus will move deeper into longevity science, cellular aging, metabolic health, and a more detailed scientific evaluation of Dr. Sebi's philosophy.